Right, and that's what my parents did. They were like, because I went to Towson.
Close. And loose, let it fall. Easy. And rest. Hey everybody, this is Dr. Warren here at Kalkstein Chiropractic, and hello to the team at Amanda Gallagher Orthodontics. And I'm so grateful to get the chance to share what we do as it relates to the TMJ cases that come in from our office. So before I get there, thank you for all the great work that you do. We have a lot of mutual patients that love your office, that have great work as it relates to orthodontic work, as well as Invisalign and the whitening and the experience overall that you guys provide for your patients. So cheers to you. It definitely comes through the patients that we see here. And now I just want to get to show you a little bit about how we assess, how we look at, and a quick video of how we assess and look at TMJ in the office, right? So we're chiropractors here, but we have also a lot of other modalities that we utilize for temporomandibular joint dysfunction. Dry needling, class 4 laser, deep heat. We also have, we do a lot of soft tissue work with our hands. And when we assess for TMJ, we're not just looking at the jaw, we're definitely looking at the neck, we're definitely looking at the shoulder as well, and oftentimes a lot of the problems usually originate from the neck. So first off, Bella here. Bella, hey.
Hey.
How you doing?
Good.
How's that jaw feeling?
A little tight.
Little tight?
A little tight.
Sometimes people are waking up with it, right? I'm sure they tell you all about it. I feel stiff on both sides, or I hear popping over here and that's where the pain is. Oftentimes they're stiff on the opposite side, and in Bella's case, she is stiff on the right hand side, and so I'm going to start with a look at her neck. Okay, so sit up tall for me, Bella. Good. I'm going to look at her range of motion in her cervical spine and rotation to the left. Right off to the bat to the right, a lot of tightness on the right side of her cervical spine, especially in the suboccipital area. You can't clench your jaw without clenching your neck is a term that I learned in school, and that's because from a function standpoint, the masseter and temporalis are closely associated with the muscles at the base of the skull. They stabilize the jaw in order for them to be able to do what they do, which is close mostly. Gravity is in charge of opening the mylohyoid muscle underneath. Go ahead and lift up for me. Stick your tongue to the roof of your mouth. That muscle that kind of kicks out when people do that, that's your mylohyoid. That's kind of the antagonist, or the only thing that opens the jaw and allows it to deviate down upon opening. So, assessment of the neck first. I'm already getting a little something on the right side with Bella's neck. I'm going to look at lateral flexion. And when I laterally flex people's necks, I'm not just looking at how the musculature is stretching on the opposite side. I'm feeling for stiffness in the joints. Okay, right suboccipital tension on rotation. Right suboccipital stiffness on lateral flexion into that side. She has restriction in this joint right here, okay? And then basically that's kind of a lot of information already for me to kind of dive into, if you will. But let's go and look a little bit more. Let's look at extension. Extension is really clean, it looks good. I'm gonna look at flexion with rotation. Again, another way for me to assess the occipital and landal joint where she's got joint restriction. All right? Now, to the jaw. Least and last is a really nice way to look at the jaw. So if I have Bella do an amazing job for the camera of opening, nice and slow, and closing, okay? I can feel it with my finger, and hopefully you can see it with the camera. Look at the angles of the edge of her lips as you go ahead and open up. This angle should be a little wider, and this should be a little shorter. I feel more tension on the right side as she opens up. The masseter muscle has a little bit of a trigger point in here, or a stiffness in the muscle close. Good. And this joint opens least and last. I don't feel a whole lot of deviation side to side, so I'm not going to mess too much with the pterygoids, but I am going to definitely assess her temporalis muscle and her masseter muscle, and I might do a little internal work side to side in terms of gliding if it's not cleaning up. So I'll show you a little bit of the treatment relative to that, okay? And it's going to be quick little clips. You'll see dry needling, you'll see class 4 laser, and then you'll see some of the adjustments that we do for this type of a problem, as well as, if you stick around for me long enough, you'll see some simple neck stretches and upper back stretches that we tend to lean into for these type of cases. So first off, thank you for taking the time to watch. So grateful to get to work alongside you guys in this virtual capacity. And if any of your patients need any help with their TMJ issues and they're just not addressing it in a functional component, that's what we're here for. I know there's not a lot of resources as it relates to treating this problem in the community, but we really take pride in how good we treat it and how detail-oriented we are as it relates to getting good results in these cases. So thank you for your time and have a great day.
Long day.
Can I have that?
What are you going up to today?
So, yeah, I only took out the lunch for my parents.
Okay.
And I took out for my,
Yeah.
my gas, my house.
All
or
sorts
my-
of things.
Open, wide, close. You're so tight. Open. There we go. Let it go to the left. Push to the right. Let it go to the left. Let it fall, 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 fall. Close. Open. Good? Okay, I got you. Left. And loose, let it fall. Easy. And rest. Good. Good. Good, let it fall. Yeah, and then just click again. Good.